Hello, everyone. Am I audible? So, I would like to welcome all of you who have taken out time to discuss and understand art of giving vaccinations. And there will be so many questions which come to our mind as pediatricians about vaccines. We have curated this academic course for pediatricians. Considering all those factors in mind, our primary objective is to reinforce that vaccination are life-saving. They are one of the most important uh, s- immune booster which every child is fundamentally having a right to get. Our nation is supporting vaccination, and we have seen the good which vaccine bring to everybody's life during COVID season as well. In this session of ours, first session of ours, which is what are the various ways of basic vaccination care which a pediatrician should not forget. Most important aspect in form of a presentation I'll be covering for first 25 to 30 minutes. That is how to manage pain. Now, when I say pain, then we all should remember that pain is a subjective phenomena. But pain for parent, pain for care provider, and pain for children. These three aspects come into action when we start dealing with vaccinations. Whenever we deal with vaccinations, we have to come across all these aspects. And in this module of ours, we are going to understand what is the impact of pain and what is the role of healthcare workers. And one of the most important role where we will be talking today will be how well a pediatrician, the senior pediatrician, is going to help. And in that case, I would like to invite our second speaker, Dr. Alpna Shukla ma'am, to briefly have a word with all of you. Ma'am is a senior consultant and in charge of Dr. Shukla Clinic in Chindwara. He has more than 3 decades of experience and very energetic and academically oriented doctor who continuously upgrade her knowledge, who continuously upgrade her understanding in the field. Ma'am, can you unmute yourself, ma'am? Alpa, ma'am.
Hello.
Dr. Alpna ma'am will be taking parental concerns and as a specialist in infectious disease and in adolescent medicine, she has been working tirelessly in this field to upgrade and upskill parents. She has at helm of organizing various workshops for parents, for doctors in field of adolescent medicine, and has been working tirelessly to upgrade the skills of fellow pediatricians with the various academic oriented programs through IAP and in her personal capacity. Privileged to have ma'am as one of the speaker for today. We will start our session now, and in case during the session you have any questions, then feel free to put in. In case you are unable to put questions and you have a question after the session, then you can put it in the group as well. So we are starting our session now. Am I audible? Great. So our topic today is what is the basic care for vaccination for pediatricians. And in this basic care, most important aspect is how are we going to change the experience which child is about to go through, and also how to change the experience for the care providers at home. So caregivers and care providers are two aspects of healthcare, where as pediatrician we are the caregiver and provider at the time when child is in our clinic. Otherwise, we are care providers. With help of caregivers at home, we make a good team and work in favor and help children to get better. Here, when we talk about pain at the time of vaccination, it is one of the most important aspect, because this pain is important. If we don't address it, then distress in infant, child, adult, and all other associated healthcare worker will be more. This decreased anxiety during vaccination helps us to keep environment of our clinic and OPDs under control. And if children acquire less fear of needles, that is needle phobia, they are going to be more helpful in coming up with their problems to doctors. At the same time, they will be less fearful in engaging in other practices also in our clinic. If we don't manage this, then we are not going to provide a good experience to our patients. At the time of vaccination, the pain is mainly because of unpleasant physical sensation, which happens when a needle penetrates skin, and also the chemical properties of metal, at the same time, chemical properties of the chemical in vaccines will associate itself with causing some pain. Some people describe it as poke, sting, pushing, but the perception of pain is very variable among individuals because pain is a subjective phenomena. Children often perceive these needles to be painful than adults, and during this procedure related to needles, one of the most frightening health related event is happening in their life, and because of their fear for needle, they anticipate pain, and the subjective phenomena of pain increases a lot. This pain during vaccination is expected and is normal as well. At the same time, we should remember that it is our ethical obligation to minimize the pain every time during vaccination. There are various steps which come into action, and we are going to discuss about them. There is pain during vaccination, which is different from pain after vaccination. And we as clinicians should remember that pain that develops after vaccination can present as redness or tenderness or swelling at the site of injection. This usually is very mild and is not a serious thing. It can be associated with certain other common and other mild adverse events during vaccine immunization, which is also termed as AEFI, such as fatigue, sometimes headache, some nausea, dizziness, or fainting, which is most commonly seen in adolescent as their vagal activity is more after their fearful phenomena in body. Now, the healthcare worker can reduce this pain during vaccination by first by understanding that in most of the clinical settings, vaccinations are given by nurses. So you interact with your nurse, interact with your vaccination nurse, tell them what they have to tell to the parents. These parents are trusting your healthcare provider on your behalf. Make sure that these healthcare workers are proactive in communicating and proactive in judging the parental concerns. If you feel they do not uh, they are not in a position to help the parent with their concerns, then ensure that whenever there is a concern, you are the right match and you take over to decide whether the patient can be dealt or their questions can be taken by your nurses or not. Do not let them say anything which is not needed in the scenario. So, what to say is first, context of pain starts managed well if the person who is giving vaccination knows what to say. If you are the one who is giving vaccine, then you should know what to do. What is the right position? What is the right location? What is the right way of putting in vaccine? During the visit, the comfort of the patient and comfort of the parent equally are important. In case there is a painful scenario or there is some miscommunication or there is some agony, the OPD is very busy and patient and other patients are, some patients are crying, and you see that the parent who is entering in your OP is in agony because of the wait. Then you comfort them by telling them to be seated. If you have a glass of water, offer, so that mentally they are ready for a new experience. And that also helps in managing because they work as your team. So how you act also affects the pain during vaccination visit. This pain perception is different as per the age of the child. Babies from 0 to 2 year differently behave as compared to those who are 2 to 17. And in some clinics nowadays, adult vaccination is also being practiced by pediatrician because our vaccination companies have approached to help to develop that niche. So we, if deal with adult and elderly and pregnant women vaccination in clinic, then their pain perception and their pain management strategies are also different. What do you say before vaccination is important. So before vaccination, as a caregiver, you have to understand in which language you have to communicate. Then once you understand the level of your patient understanding, you choose your words correctly. You acknowledge the worry of a caregiver. You can assure them that it is normal to feel nervous before vaccination because this needle seems scary. And if you are honest that it is going to hurt a bit, but it will be normal, brief, and it resolve on its own, then they trust you more. If you say it does not hurt, it is nothing, it will be over soon, then these are vague and false pretext. If they don't trust you, the child, I'm saying, if the child don't trust you, next time they are not be so willing to visit you, and they know that this experience of vaccination, there is no one who is supporting. So you tell them what is going to happen. You be gentle but truthful and reassure them that it is going to last only briefly and it is a normal thing. Prepare the patient or caregiver by making them understand what to expect. So if they understand that vaccines prevent, then they will be happier to know that it is one of the most important protection against very bad bacteria and some viruses. What and how the vaccination is going to be carried away and how much discomfort is expected is another aspect. So you can quickly tell them that you are going to inject vaccine as carefully and as quickly as possible. If you are aiming to distract the patient, then you should be able to understand which strategy you are going to apply. Every strategy will not work in every child. If you sing a song to an adolescent, probably they will look you with a funny face. But if you do the same for a child, probably he will be happy. If you do it with an infant, they don't care. If you read a book to a child, or if you ask adolescent to be engaged in book reading, probably they will like you. But if you ask them if what is their favorite color, they will come back to you say, please don't distract me. I know all this from Instagram. So be ready to understand what they are going through, interact with them, be ready to to tackle the situation which is coming in front of you. As age is appropriate, you change your strategy accordingly, but you make sure you explain your procedure, you explain why you are doing it, you explain what it is going to feel. If it is going to feel like a poke, you tell it will pinch for a second, it is going to happen quickly, and I am going to do it as swiftly as safely as possible. During vaccination, if the patient is being carried by the parent, and you know that child will be safely held by the parent, then only you proceed by asking them to take the patient in their lap. If mother is looking restless, then you make yourself comfortable first. As a dictum, make sure that you are in a better position because you are the one who is going to do the procedure. If it is an infant and the culturally acceptable uh, probability is there, then you can also encourage them to breastfeed the child during the time of vaccination, as this helps in alleviating the child's concern and also helps them to deal with pain in a much better way. And it works both ways, by having satiety at the same time by having distraction. If patient is an older child or an adult, then relax. They should be relaxing their arm either by sitting and putting it on the upper leg while sitting, or they can hold it if they're standing, because some of the patient wish to stand while you give them vaccination. Above 9-10 years, they do have a right to tell in which position they are comfortable, so that now they start acting as your team in giving this vaccination. And you should give a verbal signal before administrating the needle if a patient understands the commands. So if you are going to tell them that they should be ready, you can say, I'm going to count till 1 2 3 or 3 2 1, or you ask them to take two deep breaths and ask them to hold their breath before the third before you over with your third breath, and you tell them that I'm going to put injection now. You put it, gently remove it, and you proceed with your procedure. After vaccination, encourage and praise them. Ensure that they feel that they have participated well in this journey, and ask for their feedback. How did they feel the pain? Was it more? Was it less? So that you understand that whatever you have done has worked for this child and you get some knowledge out of it. If you provide proper instructions on aftercare, that means if you tell them how to keep their hand, whether to move it or not, whether to keep it still, whether this arm will hurt more or not with movement, this makes them more assured about yourself and also will help them to understand that they have been taken care very well. Always inform them about sign and symptom they should watch out. That is adverse event following vaccination. And make sure you tell them about what is the common normal redness and swelling at the site of injection, and it will take how many days for swelling to go away. If you are taking care of vaccination on your own, or if you tell your nurses to do vaccination, ensure you have supervised them on doing it right by proper positioning of patient. If it is an infant, if he or she is not being held nicely by the patient attendant, then chances of having needle stick injury to the parent, to the patient, to care provider is more. Distraction and active management works very well, but it is very, very subjective. Skillful vaccination technique is an art, and do not let go of this art and try to do practice your vaccination on your own and try to give it by yourself. A comfortable position will always reduce anxiety in patient and caregiver and allows for more control for you while you're administering the vaccine. If the infant is held by the caregiver, it also helps the infant to feel secure and relaxed because they will be more comfortable. So their relaxation technique, their body and their muscle will be more relaxed, and a relaxed muscle will accept more vaccine with less pain. In comparison to that, a fidgety child, a child who is crying a lot, moving his limbs a lot, you're holding it with a lot of strength, the muscle will be taut, pain will be more, distribution will be normal, but experience will be not so good. So if you are holding a child who is an infant in your in the mother's lap, then these are the four ways of looking of how to hold a kid. So if you are injecting in upper thigh, hold the child firmly. Make sure if the legs are afloat, they are being held by either the hand or are between the legs of caregiver. If you are injecting in arm, then holding the child's head, keeping the arm prominently should be your area of expertise, and you make sure that the area is exposed well, support is provided adequately, and child is supported well by the caregiver and care provider at the same time. If it is 2 to 17-year-old, you ask them to choose the right position for them. If they want to sit in chair or they want to lie down. If they have a history of fainting, better to make them lie down and let them relax. If it is adult, elderly or pregnant women, then sitting up in chair or lying down according to the history of fainting. Ensure that you give Adam abundant of time to understand how they cope their pain. If they like distraction, you use all the strategies. If they like knowledge, discuss it about the vaccine. If they like to discuss and then proceed once they are comfortable, then give them their time. Don't rush into procedure, because for pediatrics, vaccination is one of the most important skill or procedure, I will say. It helps us to take care of many aspects, and if we make it a good experience, then it is going to help us in bringing and delivering more smiles as we start counting number of vaccines in a day. So this one strategy of distraction and active management is very individualistic and very subjective. It does not work equally in all age groups, so we should remember which strategy to be applied in which age group. Like I said, babies, if breastfeeding is possible and is socially acceptable, proceed with it. It helps to keep baby well positioned and relaxed and reduces pain. If child is 1 to 2 year and you feel that there are various emojis or active screen on your vaccination cot, above your vaccination cot, you can use it. You can use music, you can use distracting toys, you can try books as well. From 2 to 17-year-old, verbal distraction like talking, singing, engaging them in saying rhymes, using toys, music, videos if possible is useful. If there is history of fainting, ask patient to have a tense abdominal muscles, but the area which you are using to vaccinate, make sure that it is relaxed before you proceed with vaccination. This breathing helps a lot in children above 6 7 years. You ask them to breathe slowly and deeply and hold just before vaccination. This distract them well, engage them in the procedure, and give them an onus that they participated well. Because after vaccination, make sure you are going to acknowledge their efforts. Skillful vaccination technique comes with time. Ensure you choose right technique which minimizes pain. You choose right location. It should be above. It should be in the lateral half of the thigh and at the junction of middle and lower 1/3 of the thigh. In smaller kids, upper thigh, right or left side is preferred. If you're using shoulder, upper part of the shoulder is where it is needed. Avoid gluteal. We have already discussed on the group in what ways gluteal related nerve injuries are more. Angle of needle is according to the vaccine type which you are administering. If you are using intramuscular, subcutaneous, intradermal, you have to choose, as we have already been taught during our post graduation day, that intramuscular 90 degrees, subcut 45, and intradermal 10. So this defines your procedural skills. If you feel you are not skillful enough to do it, spend more time, practice with your colleagues, learn the art, proceed, but ensure that you take all necessary precaution and you utilize this vaccination as an experience based procedure, not just a procedure. Technique: while you are giving any way, subcute, intramuscular, intradermal, do not excessively move the needle once you have penetrated the skin and muscle. Be safe but quick. There is no need to aspirate. There is no need to pull back. After injecting in, injection site will have some pain. There are no blood vessel if you choose the right site. Very minor bleeding after injection is not a concern. If you see some blood matlab if the band-aid above which you have kept is having a ooze, just retain pressure on the skin around the injection site with thumb and index finger, but also ensure that you do not rub excessively and you do not give excessive pressure. To consider it as a uh, decrease the pain, sometimes it actually increases the pain. Once you have given vaccination, remain calm. Be prepared for questions. Stay confident, listen, and answer. Most importantly, be respectful because certain scenarios happen and you have to act accordingly. In my personal practice, there have been incidences when one of the parent was not feeling great. He was holding the child and was very uncooperative for his own reasons. He later on told me that I got scared and I panicked and I am sorry. But when he got panicked, he created a different environment. Child got vaccinated, everything got fine. Father panicked and child started crying. And then the whole plethora of things started, that the pain procedure, it is painful procedure. But after 5 minutes, he acknowledged. So once you know what you have done it correctly, you be confident on what you have done, be respectful to what you are dealing with, and also be accommodative with the new questions which might come after vaccination, because we are today in the age of information. Everything you say, everything you tell will be cross checked by one of the relative on Google probably immediately. When I say be calm, prepared, and confident, this can be dealt very well by keeping your staff and keeping your procedures very clean and nicely conducted. Do not preload the syringes beforehand, as it might increase the risk of contamination and it can also cause immunization program error by giving wrong vaccination at a wrong site and also sometimes to wrong patient. Make sure that all the supplies which are needed for giving vaccination are always nearby. syringes, vaccine tray, cotton ball, gauze, band-aid, any extra needle which you are thinking is useful, maybe not useful, but everything which you want should be nearby. Make sure that all the necessary items are only there and unnecessary items are out of vision, out of sight. Strategy combined with skillful injection technique will allow children to feel and more comfortable and also help you to demonstrate your confidence to caregiver and your patients. Prior to vaccination, prepare by knowing what vaccines you have to administer and administer them in a manner that you have reduced pain. For sake of an example, if you are giving oral rotaviral vaccine, you try to give it first. Some content of sucrose is added, it decreases some pain, and then you choose if it is a 6 week vaccine, 10 week, 14 week. Then you choose your hexaxim or a vaccine for putting in, which is lesser painful as compared to wholesale. And then if you choose Prevnar, that is the better way. So you choose your vaccines by amount of pain they are going to induce, and then you proceed accordingly. You give least painful vaccine first, you proceed with the another painful vaccine. So TT, MMR, pneumococcal, and finally HPV. These are four vaccines, and also wholesale DPT. These are five vaccines which are known to have more pain as compared to others. So if you are giving them during your schedule, try to give them last. When I say be respectful, then always remember we in society are the healthcare provider. If we are respectful and we show our professional demeanor, we will getting more respect, and we demonstrate ourselves as positive, caring, and approachable. Patient and caregiver will expect more care from us and more trust on our information if they consider us as positive person. Allow them to express their concern, understand their views whenever they are listening. Have a positive body language while you're listening. Do not yawn, do not fidget with your mobile, do not just do anything where you give them an impression that you're least interested. Try to understand and acknowledge their concern. Younger the parent, more the concern, more time you will need to bring them at level and gain their trust so that they can trust you as their healthcare provider. Once this relationship is existing, then it stays for 20 odd years and beyond that as well. So offer your options, which you're going to do, work together with them, honor their decision, and be respectful all the time. Most important consideration are involve caregivers. You can consider breastfeeding during vaccination, and multiple injections should be considered if you have options. This multiple injections and involving caregiver are one of the most important aspect. When you involve caregiver and respect their preferences and help them to assist you while the child is having minimal distress because of vaccination, they become more happy and more engaging. If you use them in positioning or distracting the infant or child, they feel more involved in the procedure. If socially acceptable, breastfeed should be continued. A good latch before proceeding immunization for optimal effect is mandatory, and this should only be done if it is acceptable to the family, not a mandate. Also remember, vaccination during breastfeeding, as research have already documented, that it does not increase risk of aspiration. Now, this aspect of multiple injection is a very common question which many parents come across when they are dealing with vaccination in our clinics. So, pain is perceived as the biggest barrier in multiple injection. In addition to those strategies which have been highlighted so far, make sure you acknowledge the concern of a parent on multiple injection and provide them assurance for pain management. Highlight the advantage that if they are giving early protection with multiple injection, there will be fewer vaccination visits. If they have to give vaccines, then tell them that your plan is to give the least painful oral vaccine first, and you, out of your experience, know that which vaccine to be given last. If you are giving multiple injections in same area, ensure that you separate them with inch apart, either on arm or on leg. But you take necessary precautions to give it in the best way possible to make this experience worthy enough, at least painful. Make sure that you know what vaccines you are giving to which patient. Ensure that all the supplies of multiple vaccines are already there. You make sure your hospital staff is equipped enough to handle you. precisely with cotton gauze banded and supporting the child limb, and do not let them move. If you are comfortable with child position, then only proceed. Before proceeding, if you feel that something is not right, please do not proceed. Please don't take it lightly. The parents are going to give you only one opportunity to talk or to embrace their journey with you. If that experience can be altered positively, then you are able to be their practitioner for another 10 to 15 years. And in certain circumstances, this relationship grows. And there will be common questions which will come to you. Will these so many vaccines going together will be helpful, or we should not give them together? So be ready with proper scientific answers. Understand that infant immune response is ready to respond to multiple vaccines, and how research supports that all the vaccines which are recommended at one time are proven with research that they give good response. Waiting for another visit probably will increase infant to risk of exposure to that disease, and giving multiple injections differently will add more pain to the child. Some parents also ask, is there any more increment in adverse effect with multiple injection? Go with the science. Tell them how these vaccines are prepared, how they are tested, how efficiently their adverse effects are less, how safe they are if they are given at same time. Sometimes parent will say, can I come tomorrow for next vaccine? So you tell them about how inconvenient it is for them to come back again and again, how inconvenient it is for the child to take vaccine again and again, how difficult it is to maintain the compliance. What if child blood is seen after injection? So you tell by keeping a gentle pressure and telling them that some amount of blood because you're breaching skin is a common thing. If you see bigger bleed, if you see that the swelling in the muscle is increasing, probably you are dealing with a child with special who needs some special interventions. Out of 1,000 children, you will come across one. Make sure you take out time in explaining what to do after vaccination, so that you don't miss on the signs and you don't miss on giving the right knowledge to the patient. This aspect of vaccine hesitancy also come when pain is more, and this vaccine hesitancy can be dealt by the patient and the parent by your care only. Allow the patient to voice their concern and fear, acknowledge them, follow up it with a caring questions to understand their concern. Do not argue with them. If they are telling you something, embrace it, understand it, explain it. Engage in a conversation which assists them. Allow them to understand what you know, what your motivations are, and how you are there to help them. Do not engage in an argument, because that will ultimately decrease their confidence on you. Rather, give them options by telling them how they can manage their pain, if at all they're feeling, during or after vaccination. If there is still excessive pain and the patient is anxious enough and is refusing to manage with pain or refuse to take vaccines, then you tell them options of managing pain, and also help them on how they can prevent this needle phobia, and how they can be prepared with various other ways of distraction during their other vaccination visit. Make sure you adapt to the suggestions depending on the resources, time, and specific settings of your practice. If there is a heavy OPD and you are dependent on vaccination and you do not want to engage, then you should have certain specific counselors to assist you. When you have their assistance along with you, it keeps your OP running, because vaccination is one of the most important procedure for general pediatrician. When I summarize, I will reinforce some common points. That pain at the time of vaccination is a very common concern, which lead to fear, anxiety, and hesitancy in patient. It is very important to acknowledge concerns of the patient and caregivers regarding pain and response to it. When healthcare worker gives vaccine, it is their important role to tell what is the fear which will come, anticipate the problem which you might see with the age, and be ready to take care of it. When you're vaccinating children, caregivers should be involved to fulfill the wishes of children, and you should assist them in implementing good management for pain. Special pain management consideration need to be made when administering multiple injection. There are various things, various distraction techniques which you can utilize, which we have already spoken, but make sure that you remain calm, come confident and be prepared. Always be respectful and let your patients and your patient care providers, caregivers have their thoughts being heard by you. Listen patiently, understand their fear, understand their decision, honor their decision, and modify it with your scientific knowledge. Have a good technique of giving vaccines, and if at all the vaccine related associated problems are not ending, then feel free to reach out to me. We are now together in this journey, and we will embrace all the questions and achieve the sole reason of starting this course of improving this experience of our patient in vaccination. There are a lot of evidence out on various strategies, and these are certain recommended strategies for decreasing the pain during immunization. First is do not aspirate. Second is administer vaccine in order of increasing painfulness. Ensure position is proper. Do not mix word, rather use neutral words. Do not use language which increases anxiety in a child. And infant, if there, then caregiver presence is very helpful. Engage them. If your setup and your socially culturally acceptable breastfeeding mode is okay, then give breastfeeding during immunization. What is not recommended is effective but not useful is topical anesthetic, unnecessary changing of needles, asking patient or looking away from the needle. Manual tactile stimulation is not very effective. In fact, people have said that using oral analgesic before vaccination or warming the vaccine is not at all useful. In infants, pacifiers and finger thumb sucking is effective but not very practical. Distraction is equivocal. It is sometimes not useful because you choose the wrong technique. Vapocoolants such as cold sprays, which are easily available, are utilized as a vaccine pain preventive mode. It is not very effective. In children, distraction works very well. Music, books, videos works very well. But most important is caregiver presence, which suits them. Vapocoolants are not effective. And in adolescent, breathing intervention, cupping, breath holding, making them understand how you are and what you are going to do helps them and brings in more trust in you. Similarly, in adults, vapocolant is not effective. Visual distraction, musical distraction is not effective. The reason of putting this slide is choose your strategy on your own. Do not let theory guide you, and make sure that you utilize your information in the best way possible. If you are using your information and you provide abundant of knowledge to your care providers, then you are doing it right. And with this, I would like to end my presentation. And now I would like to invite Alpana ma'am to start the next session. In case you have any questions, feel free to write in the chat box, or also you can put it in the group later on. And I'm happy to tell in our first session, we have more than 100 participants right now. And I'm expecting more pediatricians and health practitioners to help us in making their journey of giving vaccination to children useful, easier, and less painful. Thank you. Alpna ma'am, please share your screen. Ma'am, kindly start.
Hello. Am I audible now, sir?
Yes, ma'am, you are audible.
So, a very good evening, respected members who are all on board with us for this vaccination training. Vaccination, as we all know, is the act of introducing a vaccine into the body to stimulate the immune system to induce protection against infection or disease. And immunization is a process by which a person becomes protected against a disease, generally through vaccination. And it is one of the most cost effective public intervention which has reduced the under 5 mortality to a large extent. Immunization, of course, is one of the strong pillars of child survival. The statistics have also proven that the immunization coverage has been increasing through the decades due to the improved immunization strategies. WHO data also pointing to the same thing. Globally in 2023, there were about 14.5 million children with the so-called zero dose children. So just imagine, vaccination, as we all know, is a power pack saver for our children. Just try to revise your OPD, a busy OPD of 60 to 80 to 100 patients with sick babies crying here and there, some vomiting, some with high fever, and a couple enters with their newborn baby for vaccination. It is at this point that your concern should start. Triaging at the reception with vaccine patients to be given place at a secure and clean corner of your hospital. Priority should be given to them so that they move with their healthy baby as soon as possible out from your hospital premises and protect their baby from the surrounding infected parents. In fact, we can also keep a separate day or separate time for the immunization patients. Now the baby is entering, the parents and entering your clinic, you will vaccinate if they are vaccine acceptors. If the parents are not ready to vaccinate, as sir said, we have to explain, we have to give recommendations, and now they accept and you vaccinate them. The last corner comes when they are not actually ready. They have a lot of questions. You have to listen to them and respond to them, and then they will come for vaccination. So this whole group can be divided into three groups. One group is the vaccine acceptor group. They are fully immunized, few concerns about the vaccines, they have full trust in their healthcare provider. The hesitant group who are under immunized and they have a lot of questions. They desire trustworthy healthcare providers who can help them and guide them and solve all their queries. And the last is the vaccine rejector who are just not immunized and they lack trust completely in their healthcare providers. So all this, when the baby comes to us, is going to take a session of about 10 minutes for the first vaccination session. And what factors actually influence the parents and caregivers for the decision on routine vaccination, the broad ideas and practices about health and illness, which they have acquired from the society, from their friend circle, and of course from the media. And the political and social concerns and the issues which the media is also serving to them. So, when as is the importance of the first 1,000 days, which is being emphasized by all sectors of IAP, at each visit of immunization, we should actually take the weight, head circumference, and length of all our babies and show it to the parents on the growth chart. And show them कि आपका बच्चा कितना अच्छा बढ़ रहा है, या if there is some faltering, we can say देखिए वजन नीचे गिर रहा है. The moment you give them that visual impact, they will gain confidence in you. And give at least 5 positive points to the parents. आपने अपने बच्चे को कितने अच्छे से रखा है, इसका कॉटन कपड़ा बहुत अच्छा है, बच्चा आपका बहुत क्लीन है. Give them 4 to 5 positive points. Then they will be ready to accept your negative point. बच्चे को बॉटल से दूध मत पिलाइए, बच्चे को शहद मत पिलाइए. If you start with those negative points, their confidence is going to drop. And even though they had entered your clinic as a vaccine acceptor parent, they will be moving out as the vaccine hesitant parent. So we have to be very, very important, and we have to be very concerned with all these things. So as Sir said, vaccine hesitancy, which is a very important aspect nowadays, it threatens to reverse the vaccine, the progress which we have made with for the vaccine preventable diseases. In fact, it has been said it is an important emerging risk factor for non-vaccination and has been listed as one of the World Health Organization's 10 threats to global health in 2019. It has been proved that vaccine hesitancy is due to an individual's behavior that is influenced by 3 C's. Confidence, where there is no trust in the vaccine or the provider. Complacency, They do not perceive a need for the vaccination, and convenience, the ease or the difficulty for which the affordability, the vaccine is not available to them. Again, the awareness gap, 45% of the missing vaccines were due to awareness gap. 24% were due to the fear of adverse events. So, discussions with the prospective parents before the delivery and during the first few postnatal appointments is very important to gain their confidence. At these visits, we can provide them with the IAP question answer on vaccines and leaflets. There are three main reasons when we see for the three main factors which are affecting the acceptance of vaccine by the parents. Factors about vaccine safety, doubts about the necessity of vaccines, and of course, the lack of trust in the authorities. So it is a continuum from a parent who accepts all vaccines to a parent who refuses all vaccines. And it is actually how we convince them and how we gain their confidence to increase the number of children getting completely vaccinated. Motivational interviewing is a very important counseling method for this. As Sir said, the way you communicate with the parent, that is going to turn the patient from hesitant parents to the accepting parents. So ask open-ended questions. आपको कोई डर लग रहा है कि अपने बच्चे के बारे में आप क्यों नहीं लगवाना चाहते हैं? They will come out with so many things. If you ask them, आपको क्या डर है कि बच्चे को बुखार आ जाएगा? They will say yes or no. Reflective listening, as Sir said, sit confidently. Don't see your mobiles. Don't distract yourself and listen to what they are saying and then answer them. Of course, the media and the communication strategies take a long role in convincing the parents for vaccination. Now the patient has come to you for the first vaccination. When the baby is born and vaccinated with the zero dose BCG, OPV, and hepatitis B. But I have seen that more than 90 to 95 patients don't even know what vaccines have been given to their babies. High income people, middle income people, as well as the low income people. Highly educated parents also just come and say, हमारे बच्चे को जन्म का टीका लग चुका है, अब आगे बताइए क्या करना है. This is what they start with. Even parents who have gone for IVF, they were so concerned for the baby, they have gone for IVF. Cesarean sections have been done in private nursing homes, but still they come with पहला टीका लग चुका है, अब आगे क्या करना है. They don't even exactly know the names of vaccines and protection, what these vaccines are going to give them. The next comes when you have to tell them the 6, 10, and 14 weeks vaccination. Now you have a big cafeteria tray which has to be explained to them. Painless है, painful है, इसके साथ pneumonia है, इसके साथ ये है, इसके साथ वो नहीं, and all those things. And the patient is going to come to you with बाजू वाले डॉक्टर तो 5,000 में लगा रहे हैं, यहाँ पे तो 7,000 लग रहा है, वो तो 3,000 में लग रहा है, यहाँ तो. It means finances is a big issue for all the parents. We have to be very transparent in our communication with them regarding the vaccines, their types, their charges, etc. and why they are expensive also, so that आज के जो educated parents हैं, they come very well equipped with their Google questions. Now, seeing and hearing so many verdicts, they start thinking कि क्या मुझे वैक्सीन लगवाना भी है कि नहीं अपने बच्चे को. And most of the time they also go away with their baby. Finances, number of vaccine जो सर ने डील किया, body massage vaccination के बाद हमें करना है कि नहीं, massage after vaccination for the site of vaccine, bathing after vaccination, these are the common questions and we have to be very transparent. आप बच्चे को नहलाइए, डरिए मत, this is something very normal and natural. आप मालिश करिए क्योंकि इन दिनों में बच्चे को और दर्द है और हरारत है. You have to give them massage, leave the area where the vaccination has been given. And God forbid if the baby gets fever or viral infection coincidentally the next day of the vaccination, then you are held with questions and questions and questions for this. So before vaccination, as Sir said, fever आ सकता है. Even if you have given chicken pox, you have given MMR, you can always say फीवर तो बच्चे को थोड़ा बहुत आ सकता है क्योंकि हमने टीका लगाया है, प्रिक किया है, तो पेन थोड़ा बहुत रह सकता है. डोंट पैनिक, सब ठीक हो जाएगा. अगर बच्चा बहुत परेशान हो तो यू कैन गिव द बेबी पैरासिटामोल एंड कोल्ड फर्मेंटेशन. एंड ऑफ कोर्स सीजनल इन्फेक्शंस चल रहे हैं तो हो सकता है कि बच्चे को कोई वायरल इन्फेक्शन हो जाए. आप लोड मत लीजिएगा, बच्चा ठीक हो जाएगा. The common questions which are coming about immunization from the parent side: weren't diseases already disappearing before vaccine was introduced? हमारे जब ग्रैंड पेरेंट्स थे, because of better hygiene and sanitation. So, ideas like this are very common in the anti vaccine literature. And the intent apparently being to suggest that vaccines are not needed. Now, here is our role. Looking at the actual incidence of disease over the years, we can leave little doubt of the significant direct impact vaccines have had, even in this modern times. Another important question is which disease show the impact of vaccines best? कौन से vaccine अच्छे हैं? So there are many examples, including smallpox, which was eradicated worldwide in 1979 following a collaborative global vaccination program which was led by WHO. Another example is measles. We have seen that there have been periodic peaks and valleys throughout the years, but the real permanent drop in measles incidence coincided with the licensure and wide use of measles vaccine from 1963. With the starting of rotavirus vaccine, also we saw a very instant drop in the rate of diarrhea, in the incidence of diarrhea in those years. Since the last couple of years, we are again seeing rising trend of mumps diseases in our OPDs, probably because the people are going more towards the government sector who are giving only MR. The mumps portion is not being given to them. Probably, therefore, this rising incidence is being seen. We can explain all this. What happens if countries don't immunize against diseases? नहीं लगाया हमने टीका तो see, there are examples like UK, Northern Ireland, Sweden, Japan. They cut back the use of pertussis vaccine, whooping cough vaccine, because of fear about the vaccine at some point of time. And then the effect was dramatic and immediate. There were epidemics seen in those countries, and the incidence rate of pertussis increased to drastic length at that time. So it seems clear from these situations and experiences that not only would diseases not be disappearing without vaccines, but also if we were to stop vaccinating, they would come back again. We can give all these explanations to our parents who are coming with 110 questions. Can vaccines cause the disease? I've heard that majority of people who have disease have been vaccinated. So this is another again argument frequently found in the anti-vaccine literature. So we can always explain this apparent paradox. No vaccine is 100% effective. To make vaccine safer than the disease, the bacteria or virus has been killed or weakened and then the vaccine has been prepared. But complications will also always rise in the unvaccinated group if there is an outbreak of diseases. Will vaccines cause harmful side effects, illness, or even death? Vaccines are always very safe. Despite the implications to the contrary, there may be reactions, as Sir said, very mild fever, sore arm, etc. But these can all be justified and can be relieved with taking only paracetamol and fermentation. A very important question is relation of DPT vaccine and SID, sudden infant death syndrome. So many studies have proved that there is no such link between the two. In fact, the Institute of Medicine reported all controlled studies that have compared immunized versus non immunized children have found either no association or a decreased risk of SIDS among immunized children. Isn't even a small risk too much to justify vaccination? Looking at the risk alone is not enough. You must always look at both sides. The fact is that the child is far more likely to be seriously injured by one of the diseases than by any vaccine. While any serious injury or death caused by vaccine is too many, it is clear that the benefits of vaccination greatly outweigh the slightest of the risks. A very important question was vaccine preventable diseases have been virtually eliminated from my country. So should I still vaccinate my child with that vaccine? Of course you should, because vaccination has enabled us to reduce most vaccine preventable diseases to very low levels in many countries. But some of them are still quite prevalent. And travelers can unknowingly bring these diseases into any country. And if the community were not protected by the vaccination, these diseases could quickly spread throughout the population, causing epidemics there. And the second point is to protect those around us who may be more susceptible to disease because of their weakened immune system. Another important is multiple vaccinations. Sir has very rightly and very meticulously explained this multiple vaccine combination and why are some vaccines grouped together. Again, very two very important points are that first, we want to immunize children as early as possible to give them protection during the vulnerable early months of their lives. Also, second, as Sir said, combining the vaccines, the parents have to come lesser time to us. They can save money, their time, and also it will be less traumatic for the child. The American Academy of Pediatrics has also released a 30-minute virtual reality course to empower our healthcare staff to have effective immunization conversation with their families, to answer their questions, their queries, and convert all the vaccine rejecter and hesitant parents towards the vaccine acceptor parents. Our communication skills, how we are dealing with our parents, how we are attending them in our OPDs is the most important strategy where we can actually gain the confidence of the parents, and then they will face even the mild or the small problems which are coming after vaccination, and they will accept us as good healthcare providers. Thank you.
Thanks a lot, ma'am. And I think that vaccine uh, prevention, the effort for a clinician to help families and effort from clinician like you who are empowering practitioners to learn from this from these valid useful courses from Academy of American Academy of Pediatric and all the resources which Indian Academy of Pediatric has produced. I think a long way to go, and we will be able to achieve the right goal. uh, Thank you for taking out time, ma'am. Thank you for everyone for joining. if
Thank you, sir.
if
Thank
we
you.
if at all there are any questions, you can all post it in the group. If not, then we will be ending this session, and we will be taking all the relevant questions in our vaccination group. And after approval, yeah, I'll be ending this session, and once I will discuss with you to share this 20-minute course which AAP has designed, and we will share it in the group,
Yes,
ma'am.
sir. Yes, sir. Yes, sir.
Sure, ma'am.
Surely, sir.
Thank you, ma'am.
Thank you, sir.
Thank you, everyone, for
Thank you, sir.
joining. Okay, ma'am.